Well, last month in our Heart Talk, we began a conversation on heart palpitations. And since then, we have gotten a lot of other questions regarding this topic. So this morning, we have Dr. Shoba back with us so we can once again hit a little bit more on this important topic that affects so many people of so many different ages. We were just talking, it's not a category specific. I mean, young people, older people, men, women, all seem to experience something like this.
That's correct. Palpitations is a sensation of a fluttering sensation in your heart. You may feel flip-flops. You just feel something's not quite right. People feel like butterflies, sometimes in the chest, up in their throat. These can all be symptoms of palpitations.
And it's scary.
It is. And sometimes they are very benign. They really don't mean that something is terribly wrong with your heart. It could actually be things that you've done to yourself making the heart race.
Okay, so what kinds of things can trigger something like this?
Common causes in this day and age are actually stress, lack of sleep, caffeine, be it either coffee or tea, chocolate, things like ibuprofen, all those kind of agents that you take over the counter. But the most common cause sometimes actually in younger people can be caffeinated drinks and sodas that have got a lot of caffeine in them, and energy drinks that the kids can take to get energy. So even young people can get palpitations.
And you were saying, especially like we see a lot of these over-the-counter things that people are taking for that immediate fix, that energy boost.
Correct.
And that can cause something
Correct, and
like
they can be metabolized into drugs in our body that can actually trigger a lot of palpitations and even can cause congestive heart failure in some people. So you have to be careful what you take. Read the labels very clearly.
How long can they last? It seems like you can sometimes have them and they'll kind of come and go, and then other times they can last for a while.
There are some people that are actually prone to palpitations because they have a little extra focus and in their hearts, and for the most part it is suppressed, and things that you do can bring it on. In younger people, for example, there may be a condition called SVT or supraventricular arrhythmia, where the heart beats really, really fast and you may actually feel dizzy, lightheaded, and pass out. Those conditions can actually be ablated. You can actually go in with a little catheter, zap that area with electricity so they completely go away. Sometimes these palpitations or skip beats actually get better with exercise. You feel them more when you're resting. Those are generally the benign kind, The benign kind, they don't mean anything significant. Important to check your blood pressure, because high blood pressure, sleep apnea can sometimes trigger some of those. In older people, of course, you have to worry about things like blocked arteries in the heart that can also trigger palpitations, and you have to be careful with them. Yesterday I had a gentleman that had been having a lot of skip beats. Every third beat he would kind of feel flip-flop, and we did a heart cath on him, and he had two severely blocked arteries. One was 99%, one was 85%. He got 2 stents and is doing fine. Another older lady came in yesterday, and she had been having episodes of dizziness and passing out, and they thought she was having mini strokes. Well, lo and behold, her heart was speeding up real fast, and at other times it was becoming extremely slow. So she ended up getting a pacemaker. So sometimes you have to be sure that you're looking for more serious causes, but more often than not, it is things that you're doing, especially things like alcohol, cigarettes. And especially if you drink alcohol for a few days and then you don't, you kind of go on and off, you're a weekend alcohol drinker, you might find that you may have more palpitations later on. You eat something outside, it's got things in your food that you're very sensitive to that could trigger palpitations, whereas if you eat at home and you eat right, you don't feel the palpitations. So look for things that you're putting in your body, recent medication changes, even things like inhalers. A lot of people use inhalers for their asthma and COPD, and if you use too much of them, the heart will race.
And you were saying even over-the-counter things.
Yes, over-the-counter things, and I cannot emphasize that. Read the labels very clearly, because over-the-counter medications, even cough and cold medications, allergy medications, they've got things in them that can stimulate the heart and cause palpitations and high blood pressure.
When should you have them checked?
I think if your symptoms are persistent and they're they're preventing you from doing what they're doing, it is better to get it checked. In general, if something is not quite right in your body, it's better to get a one-time physical check with your medical doctor and make sure that it's not the serious kind.
Because I think that's what we're all afraid of. Is,
Correct.
What's going on? And the heart is one of those things you do not want to mess with. If there's something going on, you want to know.
Absolutely.
All right. right, well, certainly some great information, Dr. Shoba, and good to know that sometimes it could just be too much tea or too much coffee that day and what we
That's
put in
right.
our body. And I think if we can think about it a little bit,
Right.
we might be able to identify those factors.
Absolutely.
All right, and we've got the Heart Walk coming up next month. It's going to be a lot of fun.
Lot of fun, lot of fun. Encourage everybody to do that heart walk. Walking is good for you.
It is.
Simplest form of exercise, out in the fresh air. Awesome.
It's going to be a lot of fun. We hope you'll join us for the Tri-Cities Heart Walk coming up September 18th. Mark your calendar now. Everything happening in the afternoon right over there at Cardinal Park in Johnson City. Check out that website for more. Dr. Shoba, thank you.
Thank you.